Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments and promote legislation that protects our health freedoms. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring information from integrative health experts throughout the world. Check us out at healthmade.co. Health is what you make it. I'm Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Veronique Desaulniers. Dr. Veronique Desaulniers, better known as Dr. V, decided to retire after 30 years of active practice and devote her time sharing her personal, non-toxic healing journey with breast cancer. Her years of experience and research have culminated as the 7 Essential System, a step-by-step coaching program that has served women in 35 countries around the globe. Dr. V is an Amazon #1 best-selling author in 9 different categories, including oncology nursing, breast cancer, oncology, alternative medicine, chemotherapy, health, fitness and dieting, women's health, and reproductive medicine. Her passion is to inspire, support, and connect women all around the globe to live their best life through healing of body, mind, and soul. Dr. V, it's such a pleasure to have you on the show today.
Thank you so much, Dr. Michael. I appreciate you having me on your show to share my message of hope.
Well, it's such an important message. I understand, Dr. V, you started as a bioenergetic chiropractor, and tell me a little bit about your background and what kind of practice did you have when you were practicing?
Well, I'm a chiropractor by profession, and I guess you would say I was a little bit more advanced from my time when you think about it. I graduated in 1979. Before natural medicine was really in vogue like it is now. And so I was using everything from bioenergetic testing to nutrition, supplementation, lasers, percussors, essential oils, all of that, before it was really, really more popular. And what really instigated that was the fact that my father had been diagnosed with pancreatic cancer in 1983. And he was given no hope and was sent home to die, basically, and told that he would be dead in 6 weeks, which he was. And so, I just felt there was something really wrong with that picture because I felt that there was something that could have or should have been done for him. And back then, no internet, right? So started going to the library, doing my research, calling, cancer clinics, which were few and far between back then, and came to realize that there were things that could possibly have helped my father, but it was too late for him. So I just, really took that fire in my soul and started applying these principles in my practice and was seeing amazing, amazing results in patients. People were reversing MS and rheumatoid arthritis and cancer and all kinds of diseases. So it was pretty amazing to be practicing.
Wonderful. And why you started focus on breast cancer? I mean, why did you're sharing that message to the world? What was your personal connection with that?
Well, I'd been in practice for about 25 years, and I was in the shower, and I, tried to regularly do a breast self-exam, and, it was one of those fateful mornings where I felt that lump that changed the course of my life forever, professionally and personally. So, here I was, Dr. V, who was helping all these people, but then I found myself in a situation where I really had to take a step back and say, how could this happen to me? I thought I was doing everything right. I was under chiropractic care. I was eating organic before organic was in style. I had home births. I breastfed my kids. I was exercising. I mean, you name it, I was doing it, and yet I was dealing with a lump in my breast. I was dealing with breast cancer. And so that really led me, down the rabbit hole of research and, soul searching and really trying to understand what cancer was and what it wasn't and what was it that I had missed. And as I was going through that journey, I realized, if it was this challenging for me, how much more so would it be for the average person who didn't have 25 years experience and research behind them? So that's what led me to create the 7 Essential System. It's just a simple step-by-step guide that if you follow, A, you won't be overwhelmed, and B, you never have to fear cancer or any disease ever again, because it really takes all the mystery and all the overwhelm and the confusion out of creating vibrant health.
And I mean, I agree with you as a chiropractor, and then following every possible modality that you can think of that would create health, and then all of a sudden you have this. I mean, what was your conclusion? I mean, how did you? Why do you think that you got breast cancer?
Well, there were a number of things. So back then, I did not know what a cavitation was, which is an infection in the bone, and it literally sat on the left breast meridian. And we can talk, more about that throughout the show. I also had some thyroid issues. I was very sensitive to electropollution, which, you're looking at, that was 2006, so, a long time ago, relatively speaking, where people didn't really talk about that much. And then I also had some serious emotional issues. I had a lot of stress in my life. I was raising 3 beautiful children. I was in a very unhappy marriage, and just, a lot of stress. I just didn't deal with my stress. And then I came to realize the old childhood emotional wounds that I buried alive, right? But, feelings buried alive never die. Yeah. And so I just, like Dr. Lisa Rankin says, if you don't grow, you grow a tumor. And I really believe that's what happened to me. It just all came to a head. I created the perfect storm, and so there I was.
So what you're saying is that a lot of people think, exactly like you did, that I'm eating well, I'm exercising, so I should do well. I shouldn't have to worry about getting these serious diseases. But you're saying that there may be some things that we're not considering, like emotions is huge. I mean, that is what drives our physiology, and so to be able to then address them and correct them and look deeper, you can actually then help in your journey towards healing yourself while going through and clearing some of these emotions. And you're mentioning then those hidden infections in the teeth and jawbone, and root canals that can really mess things up.
Absolutely. And so it was a big learning process for me. I mean, I knew about biological dentistry because in the early 1990s I had 16 amalgams removed. So I understood, and I had it done properly with a biological dentist, which had been trained by Dr. Huggins. And back then, early 1991, there was not too many of those around. So it was a learning process. And as I put the 7 Essentials together, it just really created clarity for women and for their families on, what steps follow so that they can check it off their list and know that they're doing all the right things to heal and to prevent disease.
I'm curious, how did you, because there's so many different directions that you can go when you find out that you have cancer. Obviously, you start to then, I would assume, question what you do yourself, and maybe you think, should I go the traditional route? Is that the best? I'm dealing with something that is deadly. So should I go with something that feels safer, which is a traditional route? You, however, had seen your father pass away through the traditional route. So you didn't want to go down that same path. But did you consider the traditional route, which, surgery, burning, and then a little bit of a toxic soup along with that?
There was no doubt in my mind which way I was going to go, and that wasn't going to be one of them. I had been in practice 25 years, and I saw what traditional medicine did to people. They weren't dying from the cancer; they were dying from the treatments most of the time, and it just innately did not make sense to me that if something was out of balance in my body, and my body was obviously ill, and my immune system was compromised, that taking in some toxic chemicals just to kill a few cancer cells was not going to make me healthy in the long run. So, no, I knew the path I wanted to be on, and I worked with some non-traditional doctors back then. They were, I guess, integrative back then. They didn't call themselves that back then, but who really helped to guide me on the different things that I needed to do. And 2 years later, everything was clear, and I was healthy and ready to rock and roll again.
Wonderful. Well, when we get back, I'd like to get into what those 7 essentials are and why they are important. We're just going to take a quick break. Welcome back to HealthMade Radio. I'm Dr. Michael Karlfeldt. I'm here with Dr. V. We're discussing how to heal breast cancer naturally. So, Dr. V, these 7 essentials, what are they?
Well, we'll start with number 1, which is let food be your medicine. And I'm sure your audience is very familiar with how powerful food is and how it has an effect on our genes and on our longevity. So it really comes down to eating clean, organic food, very heavy with lots of vegetables and some nuts and healthy oils. If you choose to, some very clean, grass-fed, pasture-raised, healthy meats, very small portions, 2 to 3 ounces max. And just really watching what you put in your body. And, I always use a phrase, you have a choice when it comes to food. You either feed your body or feed the cancer. It's that simple.
And I'm curious for the audience that is not aware, why is organic important in this in this endeavor?
Well, commercial produce is loaded with pesticides and herbicides and all kinds of chemicals and very deficient nutrient-wise. And, when it comes to breast cancer, for example, many of the chemicals that they use actually have an estrogenic effect on the body. So they mimic and stimulate aggressive chemical estrogens, and so that's where you get the estrogen overload, not so much from the women producing their own hormones, but it's the chemical estrogens in the environment. And recently, and I forget where it was published, but there was a study done that showed that people who ate organic food had I believe it was like 25% decreased risk in developing cancer. So it makes sense. I mean, chemicals are going to cause disease. Why would you want to put extra chemicals in your body if you didn't have to?
Exactly. And also you mentioned just 3 to 4 ounces of of meat or organic or wild game. So yeah. Why that small amount? Well, excessive protein is going to drive certain pathways, like, for example, the mTOR pathway, which it has to do with cellular regeneration and creating insulin resistance and increasing blood sugar and gluconeogenesis, where the protein turns into sugar. So, excess protein can convert into sugar, and we know sugar feeds cancer. So, just moderate amounts. We don't need to eat that much protein to fulfill our dietary needs. And that kind of bleeds in then to with the organic produce, reducing point number 2 then in these 7 essential system is then to reduce your toxic exposure. So obviously then eating clean would be one way to reduce that exposure. What are some of the other ways that people can do? Well, we can't live in a bubble. I mean, let's face it, we live in a very toxic world. And so it's becoming aware of your environment on all different levels. So if you look at the macro, the big picture of your environment, are there cell towers, near you, or big voltage meters and lines, near you? So, look at electropollution. That's a big one. And, look at the smart meters on the outside of your home and, just basic, simple things like that you have to look at.
don't use chemical pesticides and herbicides in your yard and fertilizers, and then, bring that into the home and then look at, what are you using inside your home? Are you getting your home sprayed for pests? And are you using toxic cleaners? The average home is going to have over 1,500 different types of toxic chemicals that they use for cleaning and spraying and smelling and, artificial candles and sprays and cleaners and soaps and everything. And then you look at, what you put on your skin, because everything you put on your skin is directly absorbed into your bloodstream. So if you're using typical commercial products, skincare, body care products, then you're absorbing a lot of toxic chemicals, which many of them can be cancer-causing. For example, antiperspirants. The aluminum in the antiperspirant. Aluminum is classified as a metalloestrogen. In other words, it's a metal that mimics and stimulates estrogen production. And then where do the women put it? Right in their armpit, where all the lymph nodes are connected to the breast tissue. So, simple things like that. Look at what you can do, in your yard, in your home, on your body, and then inside your body, understand what's happening there. Do you have a bacterial or a viral or parasitic infection or yeast infection maybe that's compromising your immune system? And there's so many things we can do to detoxify, coffee enemas and saunas and, laying on a biomat and really, getting a good sweat going on. And just, really making an effort to stay clean, because it does take work nowadays with the world that we live in.
Yeah, we're assaulted from so many different angles and in so many different fashions. Both obviously what we eat, our environment. You have the EMFs, and you have also the mental assault. What we watch and what we listen to. All of these things and impacts us in so many different ways. And then with that increase of the EMFs and that increases stress of all these different pathogens, so they become more virulent, and then we have to dress them stronger.
Yeah.
So it's really it really takes a huge amount of effort to make sure that you stay ahead of all the toxins that you're exposed to, and it's such a big difference now compared to 20, 30 years ago.
That's for sure.
And then so the next one was balance your energy. I'm curious because I know that you were an energetic chiropractor. So does that connect then with the balance your energy as step number 3 in the 7 essential systems?
Yeah, it does. I mean, basically, we are 1 billionth physical energy. I mean, the rest we're 1 billion physical matter. Sorry, and the rest of us is all energy. So we're really energetic beings. I mean, we run on electricity, our heartbeat, our brain. We produce magnetic energy. Our cells communicate through photon light. I mean, we're just a bundle of energy, literally. And so what do we do to keep that in balance? Well, obviously chiropractic care and acupuncture and specific, exercises and, making sure that you're moving your body. Proper sleep helps you to balance your energy. Lack of sleep can actually suppress your immune system and turn on cancer-causing genes. And then along with energy comes hormones. Hormones are such an integral part of keeping our body in check. And the big myth that traditional medicine has promoted is that women's hormones are driving breast cancer. And if that were the case, every 20-year-old on the planet would have cancer, right? Our hormones are needed for our immune system, our cardiovascular health, our brain health, our bone health. And so it's very important to understand how you balance your hormones. Do some saliva testing to see where your hormones are. There's many, many things that you can do to help balance your hormones. But, don't guess when it comes to your health. Work with a healthcare provider that understands that and will work with you in balancing your hormones.
Yeah, exactly. And it's an interesting point also in regards to then you have the phytohormones, the plant estrogens and plant hormones. So those are okay as well then?
Oh, absolutely. I mean, food is medicine, and let's just take flax, for example. I mean, the traditional oncologist or doctor will tell their patients, oh, no, don't eat anything that has, estrogen in it, like fermented soy or flax seeds. But give you an example, there was a study done at the University of Toronto a few years ago where they fed women a muffin, which was probably made with white flour and sugar, but they fed them a muffin that had 5 teaspoons of ground flax seeds in it. And they fed them a muffin for 30 days before they had surgery. And they measured their markers and the size of tumors before and after. And they found anywhere from a 30 to a 73% reduction in tumor size and breast cancer markers as a result of just eating that one muffin every day. So, things like flax, ground flax, has very protective effects. It protects your body from the aggressive estrogens and protects the estrogen receptor sites and helps you to remove some of the more aggressive estrogens from the body. So it's all good for you.
So in essence, you're saying then that the plant estrogen or plant hormone is a weaker form then of the hormone, so that it doesn't. It kind of blocks and these chemical hormones or xenohormones from locking into those receptor sites that can then stimulate cancer. So by eating the plant, then you block these chemicals from landing on those receptor sites. Is that
correct? Correct.
Okay, wonderful. Well, we're going to take another quick little break. There's really exciting information here. How because breast cancer is probably one of the biggest plagues that women are dealing with nowadays. We'll be right back just after these messages. Welcome back to HealthMade Radio. You're listening to Dr. V. I am Dr. Michael Karlfeldt. We're chatting here about what you can do to heal breast cancer. So we were talking about balancing the energy, and obviously there we chatted about balancing the hormones, how important that was, and that women should not be afraid of their natural hormones. So traditionally then, if somebody is dealing with a estrogen or progesterone positive cancer, they put them exactly on some kind of a medication that blocks their hormones. So what are your thoughts about that?
Well, technically and legally, I'm not going to give any type of medical advice here. I'll give you my opinion about what I think about those hormones blockers or what's been documented. Let's put it that way. So, for example, if we take tamoxifen, tamoxifen is classified as a potential carcinogen by the World Health Organization and the American Cancer Society. So tell me how that's going to help somebody who's already dealing with cancer. I mean, it causes secondary cancers, and unfortunately, I've met women and talked to women who've had that exact experience. Endometrial cancers, uterine cancers, as a result of being on that medication. And so it goes back to logic, really. Do our hormones cause cancer? Well, I don't think God makes mistakes when He creates our bodies, and He creates, He gave us hormones for a reason. And so we have to look outside of that box and think clearly, look at the environment, look at a woman's ability to metabolize or methylate or break down estrogens. Now, there are women, and I'm one of them, who have a genetic weakness where we have a hard time methylating or breaking down certain things like heavy metals and hormones and pesticides and herbicides. And so if that's the case, then you support your methylation process with specific supplementation, and that allows your body to break down those estrogens so that you can be excreting them from the body and they don't keep recirculating.
Yeah, exactly. And kind of the next step that you have then in regards to your 7 essential system, it's so you balance your energy. I mean, first you make sure that whatever you put in your mouth is the medicine. Every bite that you take, you said either you choose health or you feed your cancer. Second then is obviously get rid of the toxins that drive the cancer, and then you want to make sure you stay in balance both energetically and then also then hormonally, which is part of the energetic component. But then something that is really kind of on the subconscious and underlying way disturbing this balance, even though you may not think about it, are your emotional traumas, emotional wounds, things that you've dealt with from childhood that you may not want to look at. And it may even be something that your parents dealt with, and you're helping to kind of carry their emotional trauma to help them out, so to say. So how do you go about then healing these emotional wounds? I mean, because it's so hard, and a lot of times you don't even know what they are.
Well, that's the first step, and essential number 4 is typically the most difficult one for women. It was for me, because we're all such good stuffers, right? We just stuff our emotions, and we just say, "Oh, we're fine," and we just keep moving forward without allowing ourselves to feel. And so, really, first of all, if you have cancer or if you have any major dis-ease, there's something going on with your emotions. Either you're not managing your stress properly, or you haven't dealt with your past, or there's still some bitterness, some anger. And it's all about learning to let go and to forgive yourself, forgive others, and to really come to a clear understanding that, it's okay if your childhood wasn't perfect. Your parents did the best they knew how with what they had. But it's understanding how did those childhood wounds affect your adult decisions. So, for example, in my case, when I was in my early 50s, I finally discovered why I had made such bad decisions when it came to relationships, and why there was so much turmoil in my heart and soul all the time. Well, I'd been sexually abused by a convicted pedophile when I was between the age of 3 to 5, and so this is like the late 1950s. So the police literally went door to door in our neighborhood and warned everybody that we now had a convicted pedophile living beside us. He was my next door neighbor, but I never, nobody ever talked about it. My sisters knew, my mom knew, and it was one of those repressed memories that one day after therapy, it just all came out, and I confirmed everything with my mom and my sisters, and they all knew, but they never said anything. So it's those types of things. Not that everybody's going to have repressed memories, but if you tell yourself everything's perfect and you're okay, you don't want to deal with the past, then that's the first sign that you need to deal with the past. Yeah,
it's fascinating. I had a patient with colon cancer that came to me, and she mentioned in her journey that when she was diagnosed with colon cancer, she had the emotional response, "Oh no, they found my garbage dump, where I dumped my garbage." So it was almost like, what she tried to hide subconsciously, all of a sudden it was hidden. I mean, it was found, it was discovered. Right. And but going through her journey, like you did, she said that this was the most healing journey, and the cancer was her biggest blessing to really point out the need to change and to really discover and heal those wounds, that she's been carrying for all these years.
Yeah.
So how did you, when you say heal your emotional wounds, so in addition to then discovering these, I mean, is there a certain healing process, or is just the discovery of it the healing process?
Well, there's so many ways to work with our emotional wounds now. Energy psychology is so big, which it connects. It's not just talk therapy, but it connects the body and the mind together. So one of my favorite tools is emotional freedom technique, or EFT, tapping. I've been certified in it for about 15 years now, and it was really amazing for me to see the shift. And again, when you're on a healing journey, don't try to figure all of this out by yourself. Get a coach, get a cancer coach. We have several good coaches that can guide you through the 7 essential system, but also work with emotional coaches. Like I had 2 EFT coaches. I did a lot of therapy, and there's so many different types of therapies that can be beneficial. Read a lot of books. We have a recommended, almost mandatory reading list of books that you really need to dive into if you're going to get through this journey. It's not just getting rid of the lump or the bump, but it's about transforming your life, because how you've lived your life has brought you to this point. And so, your healing journey is really all about change and transformation. Absolutely.
I couldn't agree more. And and then moving on to the 5th essential, which is an embrace biological dentistry. We already spoke a little bit about that. Actually, let's take a quick break because I want to chat a little bit more about that. We'll be back in just a moment. Welcome back to HealthMade Radio. You're here with Dr. V and Dr. Michael Karlfeldt, and we're talking about the 7 essential systems in regards to what you can do if you have breast cancer, and also, obviously, to prevent breast cancer in every possible way that you can. Obviously, we can't say that we 100% can prevent anything, but you want to increase your chances, and this would be the way to do it. So we were talking a little bit about biological dentistry, and that is your 5th essential. You were mentioning something that the tumor was right along, or the cavitation that you needed to do was right along with the breast meridian. What does that mean?
So your teeth are living entities, and they're connected to every organ in your body through the acupuncture meridian system. So if there's something toxic or dead in your mouth that's on a tooth, then that's going to affect the energy flow. Think of it like a circuitry, an electrical circuit that's being short-circuited or damaged because of the heavy metal in the tooth, or because of a root canal, a dead tooth or an infection. Now, so that's one way that, dentistry or your dental health is going to have an effect on your breast health. But then when you look at it from a chemical point of view, if you have silver fillings, amalgams, they're 50% mercury, and mercury is the most toxic element on the planet. And every time you brush your teeth or eat, you're releasing methylmercury vapors into your body. And if you have a root canal is like having a dead appendix or a dead gallbladder. No matter how clean or aseptic they try to make it, it's a dead entity. And there's always unhealthy bacteria at the root that are, leaching a lot of toxins into your system. And then, of course, you have to look at gum health and gum disease, because those bacteria, can also cause problems. So, work with a biological dentist who understands that connection and can guide you in the right path.
And it's important also then, you're mentioning biological, and you're using the name Dr. Huggins. Somebody's been trained through his method. Some people will say, well, no, I should get my silver fillings out, and they just go to their dentist around the corner and just have them, drill away and get rid of the silver fillings. I mean, what's the danger of that?
Very, very dangerous. You're leaching tremendous amount of mercury vapors into your body, and, your body may crash after that. I mean, it's so highly toxic. Yeah, don't fool around when it comes to those. Make sure that you work with somebody who's certified, who uses the right equipment and knows what they're doing.
Yeah, actually, this was not a patient of mine, but it was somebody that I encountered that mentioned a dear friend of his, who's dealing with cancer, and they removed the silver fillings, and not in the correct way, and that cancer just exploded, and he died shortly after. So it is an important part. I mean, it's very, very important to make sure that you have somebody that knows how to do it in the biological way. So that's an important point. And then you have the how to repair. Then, I mean, as the essential number 6, using then therapeutic plants. Tell me what are some of those plants, and what kind of repair do you need to do?
Well, this is where we repair our body with therapeutic plants and herbs and supplements and, everything from prevention to active healing. We know that evidence-based natural medicine, there's thousands and thousands of studies that show us that, these things can boost our immune system, prevent disease, and even kill off cancer cells. So, very basic things. It's amazing to me that women with breast cancer who are seeing an oncologist and they show me their vitamin D levels and they're in the teens or 20 and, their oncologist doesn't even tell them to take vitamin D. So let's start there. If you take vitamin D and you make sure that you're in the optimal range between 80 to 100, you're reducing your breast cancer risk by 82%. Just doing that. So, that's a great place to start. And if you take it while you're on a healing journey, it's definitely going to improve your odds of survival. Then there's other things like basic things like iodine to make sure that your iodine and your breast tissue is getting enough iodine. Then, you can look at all the different medicinal mushrooms that, boost the immune system. There's, high-dose vitamin C. There's basic things like trace minerals, magnesium and zinc and selenium, which, are responsible for hundreds of enzymatic and biological processes in the body that, boost your immune system. And so many things that can, literally, kill those cancer cells without causing any harm to your body. And
then we have something that we always wonder about is a mammography. How important is that? Because we know that the early detection is crucial, and then the sooner you find it, the more options you have. So what are some of the better early detection tools, and what are your feelings about mammography?
Yeah, that falls under number 7, keeping a pulse on your health and really practicing true, early detection. Well, mammograms, I've never had one. I don't plan on ever having one. But a 25-year Canadian study on 90,000 women showed that mammography did not decrease breast cancer mortality rate, not even by 1%. And they were just as effective in finding a lump as a breast self-exam. So, when it comes to mammography, when you think about it, radiation causes cancer. And so if you continue to radiate your breast tissue and continue to compress it, ask yourself, should that be good for your breast tissue? Is that something to do? Now, I'm not telling you not to have a mammogram, but always do something in conjunction with that. Don't just rely on one thing. Do ultrasound, do thermography. Thermography looks at the infrared heat that's being emitted from your body. So if there's inflammation, if there's hormone imbalances, it's going to show up on the image. And so that'll give you a clue that perhaps there's something unhealthy going on. Because by the time they find something on a mammogram, it's been there for 6 to 8 years. So, for me, I'd certainly want much earlier detection.
So you're saying that with thermography, you're actually able to detect it way earlier than having a mammogram?
Well, thermography does not diagnose cancer, but it's going to detect physiological changes that are going on in the breast. So it can pick up things, changes on a cellular level, but, versus finding it when it's a big tumor. And like anything else, nothing is 100% accurate, but it's certainly going to give you an insight into what may be going on in your breast tissue.
Yeah. And what are some other tools you can use? Are there like blood tests and things that you can use in addition to find things out?
Yes. Fortunately, there's more and more tests now that we can look at. They're calling them liquid biopsies, where they can look at cancer cell DNA in the blood or circulating tumor cells or different types of proteins or hormones that cancer cells are giving off. One test that I really like that is relatively new is called the IV gene, IVY gene, GENE, and it looks at free-floating cancer, DNA in the blood. And basically, if you're in the green zone, chances are things are really good for you. If you're in the red zone, then you probably have some sort of active cancer. Now, they've only clarified 4 so far, but they're working on developing, more, different types of cancers as well. So, that's just one example, but there's so many other tests too that you can look at to keep a pulse on your health and make sure, even though your doctor told you you're cancer-free, they may not see a visible tumor anymore. They may not see it in the traditional blood work, but, you've got to dig a little bit deeper. You have to look at, do I have any stem cells, breast cancer stem cells that are still floating around, or circulating tumor cells, or, really take charge of your health and take it one step further.
So even though there's no lump or bump, and you're saying then that you still can have these circulating tumor cells that can promote cancer anyway, and this is something that's very important then to look at, in addition to then obviously not having the tumor site.
Absolutely. You can radiate or have surgery, and get rid of that lump, but you still have circulating cancer cells. So you have to address those. That's the root cause of where the cancer begins in the first place.
Yeah, absolutely. And so I just want to reiterate, so you had a tumor, you had breast cancer, you did these 7 steps, the 7 essentials, and then you were declared cancer-free. Yes.
And I'll just take a moment to share. So in 2015, I had a recurrence, and by then I was the breast cancer conqueror, and coaching women all over the world. And so here I was, facing the same situation. So that was a double whammy for me. But again, it was one of those situations where I had to go back to the drawing board and say, okay, what am I missing? What am I doing wrong? What's out of balance here? And it was just so obvious that once I did that, I saw, I was stressed. I was trying to heal the world and all these women, and it was just too much. I was sucking in all that breast cancer energy, and I just had to kind of take a step back and reorganize my work. And, there was still some emotional wounds to heal. I developed another cavitation that I had no idea I had, and had an autoimmune issue. So a number of different factors. I found myself in the same situation, but 3 years later, happy to say all is well, all is clear, ultrasounds are good, blood tests are good. So everything is great.
Wonderful. Yeah, it's interesting to me. I mean, breast cancer, it's such a nurturing organ. So if you're trying to then nurture the world, I mean, that's going to put a lot of stress on that organ. That's for sure.
Yes, it will.
Well, it's been such a pleasure having you on the show. And I want to urge all the listeners to go to your website, breastcancerconqueror.com. And it's just a huge amount of information there, a lot of amazing podcasts that you've recorded. So it's a huge amount of value to go there and learn about what you can do to minimize the risk, and also to battle something that you might be battling with. That is all for today. I am Dr. Michael Karlfeldt with HealthMade Radio. Remember to connect with us at healthmade.co. Health is what you make it. And I thank you so much, Dr. V, for being on our show.
You're very welcome, Dr. Michael. Thank you for having me.
My pleasure. Thanks.